We're back on Politics Nation with some heartless governors vowing to block President Obama's health care law. And today we're learning the states with the highest number of uninsured are the ones trying to leave them with nothing. Leading the way is Florida's Republican Governor Rick Scott, whose state ties for second to last in the country. Yet he put the cost over people.
Any expansion of Medicaid, which is already growing at 3.5 times our general revenue, is going to be tough. Every time we expand Medicaid, we make it more difficult to fund our education system.
How do you respond to the wide range of sources that say you simply have these numbers wrong?
It depends on what number you want to use, how fast it'll be implemented. But the truth is, it's a lot of money. Whatever the number is, it's a lot of money.
It's a lot of money, but your numbers are wrong. But now 6 other Republican governors say they're also going to opt out of the Medicaid expansion, and 8 more are leaning towards saying no. Today, the president had some choice words directed at those who are trying to repeal his signature law.
I believe that in America, nobody should go bankrupt because they get sick. I'll work with anybody who wants to work with me to continue to improve our healthcare system and our healthcare laws, but the law I passed is here to stay.
Joining me now is Melissa Harris Perry, host of the Melissa Harris Perry Show, and Nicole Lamaro, the executive director of the National Association of Free Clinics. Thank you both for being here.
Absolutely. Thank you.
Melissa, strong words from the president today on the law. What kind of message is that sending to the governors?
Well, I hope he's just being, really clear. Part of what's happened here is first you had the attempt to block this law ever being passed that happened with Republicans in the U.S. House of Representatives. And then you had these attorneys general bringing suit against the law in order to bring it to the Supreme Court. The Supreme Court has now ruled the law constitutional. And now you basically have these Republican governors saying, well, okay, yes, the law has passed. Yes, the law has been deemed constitutional. We are simply not going to enact this portion of the law because this is the portion of the law that we have the right to opt out of, right, which they are accurate on. They do have a right to opt out of the Medicaid expansion aspect. But to opt out of it is to basically say those poor people who live in my state, and I mean people who are actually poor, who do not have enough money to afford personal individual health insurance, will simply go without because we're not going to take the overwhelming matching funds from the federal government in order to provide health coverage and health care for our own citizens.
Now, and when you talk about the overwhelming money from the government, for 3 years they covered 100%, and then I think it goes to 90%. So, I mean, this is just outrageous. But let me ask you something, Nicole. You work as the head of the clinics, the free clinics.
Right.
What does this mean to actual people? Nobody discusses Melissa policy better than Melissa, but I'm talking about human beings that goes into the free clinics that you head up nationally. Give us an example of not having access to Medicaid, what this will do to actual people.
Well, I think it does a couple of things. First and most importantly, I think the patients that come to free clinics get a bad rap. Most people think they're living on the dole. 83% of our patients come from a working household. These are hard-working Americans.
When you say 83% come from a working household, you mean people in there are going to work. They're not laying around watching television, living off the government.
Exactly. They're working every single day. Sometimes they're working 2 jobs.
Wow.
These mothers are making a hard choice. They're making a choice between getting health care for their child or putting food on the table. That isn't a choice that anyone should have to make. In this country, health care should be a right and not a privilege. We see patients every single day that are already telling us that 2014 is too far. It's too far away. I can't wait that long. I need help now. And more importantly, when we talk about what is affordable, we have patients who are telling me, I can't afford a $4 medication. So if they don't get access to health care, they're not going to get any health care. And that's a big problem.
And these are people that are working poor, Melissa. When you look at the unemployed, I talked about Rick Scott. Florida, 21% of the people needing insurance is unemployed. South Carolina, 19% under Governor Nikki Haley, who's also talking about turning it down. Governor Bobby Jindal, your governor in Louisiana, 17%. And when you look at the fact that, let's just take Florida, how it is working there, 224,000 young adults are now covered under their parents' plan in Florida already. Medicare patients saved $247.5 million on prescription drugs, working in Florida alone right now, that number. 5,918 thousand residents with pre-existing conditions are now able to get insurance just right there in Florida. So, I mean, is this such a political kind of move built on they want to defeat the president and not agree with the president, that they are unmindful that it's working, and the thousands upon tens of thousands of people they're impacting in their own state?
Absolutely. I mean, there is no other explanation for it. Rev, you are talking about governors who have done everything they can to make it impossible for minimum wages to be raised to a level of living wages. So as Nicole just pointed out, you have people who are working sometimes multiple jobs, but because these are the same governors who have also resisted forcing corporations to provide reasonable benefits for employees who work, say, 35 hours or 30 hours, sort of just enough but not enough to get benefits. You have all of these folks living in states, often states that have higher percentages of poverty, higher percentages of unemployment than what we see at the national level, who are also now resisting the most basic kind of humanizing health care. And I think that part of what's so appalling here is that it's going to be the most vulnerable. It's children. Yeah. It's women who are raising children without the benefit of a spouse or partner. It's people who are dropping into poverty suddenly as a result of home foreclosure or as a result of other kinds of unstable living circumstances. Part of what we needed to do in this country is say, as the president just said, no matter what happens, we just don't live as Americans in a country where we think it is okay that simply because you're having a hard time that you will also be ill and that you will not be able to access this extraordinary health care that we have available in this country.
And you know, the Politico is reporting today that there are more legal challenges coming to the law. Quote, they're going after pieces of the law like the contraception mandate and the new Medicare panel that Republicans are calling rationing board. The fact is, though, Nicole, if these governors opt out, people that come into your free clinic will have nowhere to go.
That's right. They will continue to utilize free clinics, which have been filling gaps for years, where these people don't have anywhere else to go. I'll tell you what's going to happen. If this doesn't get expanded, more people are going to go to the emergency room for their health care. And that's something that we all don't want.
And guess who pays for that?
Us.
Melissa and Nicole, thank you both for your time. And don't miss Melissa Harris Perry every Saturday and Sunday at 10 a.m. right here on MSNBC. Straight ahead, it's the hottest mystery of the summer. Who is the Supreme Court leaker? Somebody's talking, and we'll try to crack the case.